This is a video on how to start an IV. Starting an IV is a critical skill for a physician to have in order to administer IV medications, to administer blood products, or to administer IV fluids. And often the physician is going to be the one who is called after there's been multiple attempts at starting an IV. So a physician needs to be able to be skilled in starting an IV. There are a few contraindications to starting an IV. That would be if there is an acute injury to the extremity you want to start an IV in, if there's any kind of burn in that extremity, or if there's any kind of infection. Now, we are specifically talking about starting pediatric IVs, and there's some things that you need to remember for the pediatric population. One is that younger children have a thicker layer of subcutaneous fat, and that often makes it more difficult to visualize the vein that you are sticking. So you need to be skilled at palpation and knowing your anatomy of your veins so you're able to pick out a proper spot. The other thing you need to keep in mind is that often because of the developmental level of the child or the cognitive skill, they are unable to comprehend why we need to start an IV, and they're unable to recognize the importance of staying still and being calm. So this is when it helps to be able to have parents who are going to be able to be in the room. They can often help calm the child using one of the child life specialists who may be able to read to the child, distract them with bubbles or something like that. So you want to use all resources that you can to make this as calming and comforting as it can to a child, because most children are scared of needles, and a few adults are as well. So you have your parents involved, you may have your child life specialists involved, you're going to have a few distraction techniques that you want to use, and once you have all that ready and you've discussed with the parents the importance of IV access and they agree to this procedure, you want to, preferably if the child is going to be an inpatient, take them to a separate room, because a separate room like a procedure room, they're able to keep their room in-house as a kind of a safe haven. So take the child and the parents to the procedure room, and once you're in the procedure room, you want to gather all your supplies that you're going to need in order to start an IV. So the first thing you're going to need is your gloves. You always want to use universal precautions as you would for any child. For a child, you want to choose an appropriate size catheter. This is a larger arm that we're looking at today, so I'm going to be using a 22 gauge needle. Oftentimes with a younger baby, you want to use a 24 gauge catheter. So you get your IV catheter ready. You want to have your IV tubing ready, and what I do for the IV tubing is I go ahead and run the saline through it and make sure that there aren't any kind of air boluses or air emboli that could be in there. So I'm going to run the fluids through it till it drips and stop that. So the IV tubing line is prepped. I'm going to have this connector, and I'm going to go ahead and I would flush this with saline prior to starting to make sure there isn't any air in this line. So this connector is ready to go. I have my Tegaderm ready to secure the IV. I have my tape already torn into strips and ready to easily access just by pulling it. You already saw my saline flush. And then I have the iodine prep that I'm going to be cleansing the arm with prior to inserting the IV. And then I also am going to need a tourniquet, and you see it's already placed around this arm. So I'm going to have all my supplies ready before I start the procedure, because the last thing you want to do is actually get the stick in the right place and then have it come out because you don't have your tape ready or you don't have your tubing ready or something like that. So being prepared is an important part of starting an IV. So I have all my things ready, and then I'm going to look at the child, and you have to remember with the child some of the anatomy is a little bit different. So for a baby or a neonate, you may want to consider looking at some scalp veins. They're a little bit easier to visualize. You don't have the thicker sub-Q fat that you're dealing with for the scalp veins. You may consider in a non-ambulatory child using the saphenous vein. You don't want to use it in a child who's walking, because that would be difficult to keep them in bed the entire hospital stay. And then you also have your traditional places that you would look, such as the dorsum of the hand, veins on the radial aspect of the hand. And something to keep in mind for a pediatric patient is that they may be a thumb sucker or a finger sucker, and you want to make sure that you're not starting an IV in the hand for which they would suck a thumb or a finger. The antecubital fossa is also another good place to start an IV, but you need to keep in mind if this patient is going to need long-term IV antibiotics or prolonged IV access, the antecubital fossa is going to be where a PICC line would be placed. So you don't want to ruin a vein that would be good long-term IV access. So I often will start distally and move proximally as I'm trying to obtain my IV access. An important thing to remember for children is that children experience pain just like adults do, and you want to be sure to provide an appropriate anesthetic. So something that I like to use would be a topical anesthetic cream, and you would apply this once you assess the child, determine which site looked good for access. You would go ahead and apply the topical anesthetic and let it sit for a few minutes to get appropriate numbing. And what you want to keep in mind is, I already discussed having the parents there, you want to have a child in a position to where you're not leaning over a table trying to get to them, and you're not having to hunch down in order to get to the child. So oftentimes you can raise the level of a hospital bed, you can use a stool to sit on, you can change the side of the table that you're going to be on depending upon where the access is going to be, and then you can make your decision from there. Because you, as the one doing the procedure, need to be comfortable with your positioning. So we're going to go ahead and get started. So this is a little bit bigger than your typical pediatric arm, but the principles are the same for starting the IV. So you're going to take a look at the patient's extremity, and you see I have some nice veins here that I would like to be able to use. So I'm going to take my tourniquet, put it into place, and that will help the veins become more visible and pop out. And I'm going to palpate a nice, soft, squishy vein and decide upon my site that I want to use. Once I decide upon my site that I'm going to use, I'm going to clean it with some iodine. Make sure that that's good and clean. And sometimes if you are going to be holding in that spot, some people may want to clean the tip of their glove if they're going to be palpating that spot again. And it helps to apply traction with your non-dominant hand, and this helps prevent the vein from rolling. And I am left-handed, so things may be backwards according to what you may be doing. So I'm going to get my catheter. As I mentioned, it's a 22 gauge catheter that I'm going to be using. I'm going to remove the cover. And with my catheter needle, I want to make sure when I'm planning on entering the vein that the bevel is going to be up. I'm going to apply my traction, and I mentioned not hunching down over the patient, so I'm going to go ahead and have a seat on the stool that is behind me. And when you enter the patient's vein, you want to enter in at a 30 to a 45 degree angle, and then, you know, of course, depending upon the site, the angle may be a little bit different. So you're going to begin at a 30 to 45 degree angle, your gentle traction with your non-dominant hand, and you're going to feel the needle go through the vein. At this point, it's important to progress the catheter, but not the needle. And you put the catheter flush with the skin. You're going to remove the stylet, and you're going to have this flashback. It helps if you apply pressure peripherally so you don't leak out as much blood. You screw on the connector cap, and you can go ahead and remove the tourniquet. Once you have this in sight, or in place, you're gonna go ahead and take your Tegaderm, and you're gonna apply it at the distal part of the catheter to make sure this is secure. Remove the lining of the Tegaderm, and then this is where all these extra pieces of tape come into play. You're going to take your tape and slide it behind the catheter here. And the tape will actually stick a little bit better to the Tegaderm than it would stick to the patient's skin. And you want to be sure when you do place an IV site that you still have nice visualization of the IV access into the vein, because you want to be sure to monitor for any kind of swelling or redness or signs of infection or anything like that. So I have this secure, and then I'm going to take my saline flush, and I'm going to flush and make sure I can enter in easily into the vein, and the saline goes in nicely. And I'm going to go ahead and take one of my larger pieces of tape and secure the connector so that the patient doesn't, with their other hand, try and pull out this IV. And then you already saw me flush this tubing to make sure I don't have any air bubbles in there. And then I'm going to connect with this little clamp. Then I'm going to roll this up to start my fluids for going. And you want to make sure that you do dispose of your sharps into the sharp box. And then you see the fluids running easily into the patient's arm. Usually with a pediatric patient, it would involve a lot more tape. If you do go into the antecubital fossa or around any kind of joint space, you probably want to do an arm immobilizer so the patient can't wiggle and take out that IV. You have your fluids going in and you have successfully started an IV.